In this video, I'm going to talk about the adult derivatives of branchial cleft, branchial arch, and branchial pouch. And the mnemonic that you can use to remember the order of these structures is CAP. So C-A-P. And in order to remember the embryonic origin of these structures, it's actually easy to remember the structure of a trilaminar disc, which has ectoderm in the outer layer, mesoderm as a middle layer, and then endoderm as an inner layer. So if you go in the same order from outside to inside, you can see that the branchial cleft is derived from the ectoderm, branchial arch is derived from the mesoderm, as well as the neural crest cells, which gives rise to the cartilage and bone of the branchial arches, and finally branchial pouch, which is derived from the endoderm as the inner layer. Now, first I would like to discuss about the branchial cleft derivatives. So this is the first branchial cleft, second branchial cleft, third and fourth one. So the first branchial cleft gives rise to the external auditory meatus, while the second, third and fourth one gives rise to the cervical sinus. And cervical sinus usually gets degenerated. However, in some patients it may persist, and if it does, then it will present as a lateral neck mass, which needs to be surgically removed. Now, in terms of branchial pouches, this is the first one, second one, third one, and fourth one. So the first one gives rise to the middle ear cavity, eustachian tube, and the mastoid air cells. And then the second one gives rise to the epithelial lining of the palatine tonsils. The third one gives rise to two different structures, the inferior parathyroid gland as well as the thymus. And the last one, the fourth one, gives rise to the superior parathyroid gland. Now, there is an important clinical correlation, and that is called DiGeorge syndrome. And these patients lack the third and fourth branchial pouch, and thus there would be no parathyroid glands and no thymus. So since there is no parathyroid glands, there would be hypocalcemia that causes tetany. And since there is no thymus, there would be no T cells, and thus there would be recurrent infections in patients with DiGeorge syndrome. In terms of branchial arches, their location is here, first, second, third, and fourth one, and I will discuss them through the table. But first, I would like to just summarize what I explained about branchial cleft and branchial pouches. So the first branchial cleft gives rise to the external auditory meatus, while the second, third, and fourth one gives rise to the cervical sinus. These cervical sinuses usually get degenerated, but if they persist, they may present as a lateral neck mass. In terms of branchial pouches, the first pouch gives rise to the auditory tube, which includes the middle ear cavity, the mastoid air cells, as well as the eustachian tube. The second one gives rise to the epithelial lining of the palatine tonsils. The third one gives rise to the inferior parathyroid gland and the thymus. And the fourth one gives rise to the superior parathyroid gland. So DiGeorge syndrome lacks the development of the third and fourth branchial pouches, so there would be no parathyroid gland in these patients, as a result of which there would be hypocalcemia, and since there is no thymus either, then there would be no T cells in these individuals. Alright, now the next structure I would like to talk about are the branchial arches, and if you use the memory aid that I've provided here, it simplifies things. So the first one is maximum 1, so 1 goes for the first arch, and then max goes for max. It's just easy. So first branchial arch gives rise to the maxillary artery, mandible, malleus, and incus. Now, in terms of malleus and incus, if you forgot what these structures are, if this is the middle ear bones, then we have malleus and incus right here, both of which are derived from the first branchial arch, versus stapes, which is derived from the second branchial arch. So just keep that in mind, that malleus and incus are from the first branchial arch. In addition, the first branchial arch gives rise to the muscles of mastication, and these muscles include the temporalis, masseter, and medial and lateral pterygoids. It also gives rise to the anterior belly of the digastric muscle, tensor tympani and tensor belli palatini. So here is the anterior belly of the digastric muscle. One other important clinical correlation that is associated with defects in the first branchial arch is that, you know how the mandible is all being developed from the first arch. So patients that have defects in that one will have hypoplasia of mandible and other facial abnormalities, and that is referred to as Treacher-Collins syndrome. Now, in terms of cranial nerves, it's much easier if you memorize this number 5, 7, 9, 10. And if you memorize this number, then you know that the first branchial arch gives rise to cranial nerve 5, second gives rise to cranial nerve 7, third gives rise to cranial nerve 9, and finally the last one gives rise to cranial nerve 10. So just memorize that number and all the cranial nerves are out of the picture. Now the second branchial arch gives rise to the stapedial and hyoid arteries. It also gives rise to the stapes, styloid, and stylohyoid cartilage, as well as the lesser horn of the hyoid. So let's just go over that again. So the stapes is derived from the second arch. The posterior digastric muscle is also derived from the second arch, and finally the lesser horn of the hyoid is derived from the second arch. So let's go over that again. The posterior belly of digastric muscle and the lesser hyoid bone are all derived from the second arch, as well as the stapedius and stylohyoid muscles. The third branchial arch gives rise to the carotid artery. So you know how C is the third alphabetic letter. So the third branchial arch gives rise to the carotid artery. It also gives rise to the greater horn of the hyoid and the stylopharyngeus muscle. So let's go back to the hyoid bone again, and here is the greater horn of the hyoid muscles, which is derived from the third branchial arch. And finally the fourth one. So the way I memorize the fourth one is F-O-U-R and aorta. So O-U-R and A-O-R sound similar, so that's how I memorize that fourth branchial arch gives rise to aortic arch and right subclavian artery, while the sixth branchial arch gives rise to the pulmonary artery and ductus arteriosus. And finally, the muscles that are derived from the fourth branchial arch include the pharyngeal constrictors, cricothyroid, and levator velli palatini. As for the sixth branchial arch, all the intrinsic muscles of the larynx are derived from the sixth branchial arch except for the cricothyroid muscle, and that is important. Now, I told you that you should memorize the number 5, 7, 9, 10 for all these cranial nerves that is derived from first, second, third, and fourth branchial arches. What I would like you to know for the 10th one is that the fourth branchial arch gives rise to the superior branch of the 10th cranial nerve, so the superior laryngeal nerve, versus the sixth one, which gives rise to the recurrent laryngeal nerve. And if you recall, recurrent laryngeal nerve is the one that is innervating the muscles of the larynx. And that concludes our discussion.